Hey there, welcome back. Today we are talking with Cone Health's Oncology Outreach Manager, Christine Brannock, and we're talking all things breast cancer. Christine, right now so many people are worried about going to the doctor because of coronavirus, but you were telling me during the break about a new mobile option instead.
Yes, so we have a new mobile cancer screening unit, and on that unit you can get your mammograms. That unit is parked at locations across Guilford, Randolph, Rockingham, and Alamance County. So if you are interested in having an appointment on that mobile unit, we also, patients that qualify for the mammography scholarship or come to our BSEP program also can have those mammograms on that mobile unit. You could call the breast center for an appointment on that mobile unit, or if you need assistance through our scholarship or BSEP programs, you can actually call our department number, and that number is 336-832-0849 to get your application for that scholarship. It can also be accessed on the Cone Health website at conehealth.com, and you can just search mammogram scholarship or free mammograms.
How has this whole pandemic changed the way people get screened and how regularly they come to see you?
I know that there was a decrease in screening. I know there was a short period of time that we weren't able to do screening mammograms. Now we follow all COVID safety protocols as far as we try to reduce the amount of patients in the waiting area. The nice thing in the mobile unit, if it's a nice day, patients can always wait outside if they prefer. We make sure everything is cleaned and everything is taken care of like it should be to decrease any risk whatsoever. All staff wears masks when they take care of patients, and all Cone Health employees also wear face protection also.
Does the vaccine have any impact on mammograms? I remember hearing that you're supposed to wait a while before you get a mammogram.
There is no actual association between the COVID vaccine and breast cancer, though what can happen is the vaccine can cause a swollen lymph node in the armpit axilla area, which is basically just your body's natural immune response to the vaccine, and that can potentially show up on the mammogram. There is no association with it in breast cancer, though. Sometimes we do advise patients to wait a few weeks before they schedule their mammogram. Typically, it's about 4 to 6. Though, if a patient does have any symptoms, such as I mentioned earlier, then it's still very important to get your mammogram and not delay any treatment. Then we would do a diagnostic mammogram or whatever follow-up is needed for those patients.
I just can imagine that could lead to some false panic for some women out there.
Yeah, and they may call you back for some additional images just for some reassurance if they were to see something or if you felt something. But again, it is very important to let your provider know when you had your vaccine and let them know any symptoms that you have.
How much does early detection increase your rates of surviving this?
It's tremendous. Right now, currently, we have over 3.5 million women in the United States alone that are breast cancer survivors. So it's very important. And honestly, I've been in this position for almost 20 years, and that is a huge impact compared to what it was then. When many more women are surviving and beating breast cancer. So it's so very important that we get checked out like it's recommended, and that we are aware of what's normal for us, and if we notice any changes, to make sure that we report those changes to our provider. And if a woman doesn't have insurance, to contact us for one of our programs. We will make sure that you get the care that you need and the follow-up that you need.
You know, us guys, we want to help out too. What can we say to the wonderful women in our life to encourage them to go get the mammogram?
It's so very important to take care of your health, and as I have mentioned, and I couldn't say it enough, that the chance of survival and the options of treatment are so much better if we find it early before we were to ever have any symptoms.
Well, thank you so much for your time. We really appreciate your expert insight here. If you missed any of this, we're going to put it all up on our website, WFMYnews2.com. Just check the 2 Wants to Know section.